Two thoughts come to my mind right away, Dave. First, you talked about that gentleman and how he contracted that disease.
Yeah.
If the prevention mode had been in place, if possibly the governmental occupational safety and health regulations had been there to protect that gentleman, the whole situation that sadly happened to him, again, may not have been.
The company knew it was dangerous. They did it anyway. They paid a huge settlement to everybody who was ill, but most of them died.
And that's the regulation piece that has value because it does protect the health of the public.
Okay.
The second piece you brought out, which I think is an interesting element, is, again, this goes back to the American democracy, the idea of deliberation, not debate necessarily, but bringing people into a room, identifying a challenge and an issue, and then finding solutions, possible solutions. That's one way for us to move this forward, and that's what I'm suggesting here too, is if we look at the health of the American people, if we just have that dependency on the sickness care side, if we don't bring the health promotion side into the room, fund it adequately, and there's a smart reason for that, because you save money. I talked about examples before of people who, you get a condition or something because it's identified too late in life. It could have been prevented, the cost of that. There are some who have even suggested that if we do cover all of America, the cost of covering them will be less than the cost that we're paying, because where do they go for treatment now when they have a condition? They go to the most expensive source, often the emergency room. So, and I think there's always been, David, in America, a resiliency, an ability for us, again, with community involvement, to solve the challenges that we face. We did it with tobacco. We're working on it real hard now with physical activity and nutrition to bring about changes that will create community cultures that support healthy lifestyles.
Well, we started with tobacco because there are still some very unfair elements there. Children who live in homes where the parents smoke can't control whether their parents smoke, and yet they are being exposed to carcinogens, which according to medical experts have half the danger to their own bodies as if they were smoking the cigarettes themselves, which means long-term chronic bronchitis, emphysema increases in risk, as does lung cancer. So when we still have 22% of the American public, half of what we're smoking back at the peak, we've started that work. Let me ask you this. People don't have to talk with you. You're from the Wellness Institute of Greater Buffalo, 501c3 nonprofit, trying to figure out some big, large-scale solutions like companies improving wellness in the workplace, individuals eating better, exercising more. People don't have to talk with you. The managed care organizations don't, the hospitals don't, but do they talk with you? And what's the attitude you're seeing from them when you start talking about some of these global solutions that your organization tries to espouse and move forward?
Well, first off, change, there's a simple formula for change, Dave. Change is driven by dissatisfaction with the status quo. This is called the Haberstro model for change. So if people are unhappy with the status quo, we'll hear from them, okay? The second thing in that...
Are people dissatisfied with the status quo in America today with medicine?
I would say absolutely yes.
You sure about that?
Yeah, in the context of cost, okay, and what they're getting out of it, the value equation. Are we getting a healthier America? That's not to discount the marvelous things that the medical community does.
But is the American individual doing their part? Are they taking personal responsibility for their health in all that they do? What do you think?
I think there's a balancing point there. Some are, not enough. But then you've got to go back and ask the question, well, what is creating poor health in our society? Let me use physical activity as an example. Did you walk to school when you were a kid?
Yes.
Do your children walk to school?
Well, I don't have children, so that's a hypothetical.
But when I go out and I speak in public and I ask about that, the adults raise their hands, 80% of them. I walk to school, their children, we bus them. So there's, I talked about public policy and what its influences are on behaviors. Do you open your garage door by hand?
I'm not doing well with any of these questions. I have a button that I press, and I have a very strong index finger at this point.
But my point there, David, is that it's a combination of factors. It's the individual choices and responsibilities and having the knowledge for that, and the opportunities and the access to healthy foods and places where you can be physically active. It's the changes that are going on in our society. We talk about screen time now. How much time people spend in front of the television, they'll be watching your show, how much time they spend in front of the computer, how much time the kids are playing those games. you know, that's all just technology. But there's new technology, too, that works for us. Some great companies in America have come up with these online fitness and sports activities that you can do that people are loving. So my point is, again, is to your question. There's personal responsibility, there's trends occurring in society, and then there are the responsibilities that society has as a whole.
I give you a magic wand. The magic wand has the power to change 2 things in America relating to health. Here is the magic wand. What are the 2 things you're going to change with the power vested in you as the holder of the magic wand? We'll call it the Medical Matters World Health Improvement Magic Wand. What are the 2 things you're going to change?
2 things. I would I would work to increase and improve the participation in the American democracy, to get citizenship up in the forefront, to give people the skills and knowledge that they can use to create change in their communities. That'd be the first thing I'd do.
I don't understand the first one. Say it again and explain it to me.
The democracy. I would
remember Ricky Ricardo?
Yeah.
Got some explaining to do.
Okay. I would like citizens to have greater skills and ability in their own communities to create change. In other words, ways to get involved. Say you want
involvement of the public in some of these issues on a day-to-day basis where they're aware of them, and thinking of them, and taking responsibility for them.
And that's a norm.
That's asking for a lot. Yeah,
right.
Okay.
But it's part of what America's history is all about.
Well, it's how we became a country, after all.
Exactly.
Was people here decided to make a change from domination under
And
England.
then the second thing I would ask them, what I would look is to help them to understand where health comes from. Again,
where does health come from?
About 10% of it, this comes from Robert Wood Johnson Foundation, about 10% of it from the medical.
See, you have to tell people more than once. I'm proof of that, you see.
Right.
Because you did tell me this earlier in the show.
The medical system. 30% of your health today is said to come from your genetics, and that whole world is blossoming. There's going to be some interesting things in the future. 60% of your health comes from your personal choices and the environment that you live in. So if you understand where...
What are the personal choices you want in Americans then, based on the things that you've learned at the Wellness Institute?
At a minimum, we want them to meet that Surgeon General's recommendation for physical activity, 30 minutes a day, most days of the week. That's about 5 days a week. If we could get all of America physically active, meeting that Surgeon General's recommendation, their health would improve, our economics would improve, our environment would improve, and the efforts to bring them together to do that would strengthen our democracy, because they work together as a community to create the changes in their community.
Don't you just want us to sit and eat French fries and cheeseburgers and sit and watch the computer? That isn't what you want. You're saying out there and active.
But you know what I'm going to say, Dave? I don't mind a little of that. A little moderation in all of these things. I'm not the fitness police. I've been accused of that before. But it's really, again, it really settles down to those 2 good things. A healthy democracy, citizens involved in our communities, working with governments, working with businesses, because they've got a vested interest in this, and the health of the marketplace, working with the nonprofits, and then working together as a community, developing a good plan, knowing where you're at, creating a vision for your future, and having a good strategic plan. You can change health status. We've proved it. We've done wonderful things with tobacco. We're doing great things with physical activity and nutrition, and there's other critical issues in the health behavior areas, again, over time, that we will work towards as a nation to improve our health.
I have a personal challenge for you, the viewer, and I'm going to ask you this question. Are you personally satisfied with your personal health and the health care of America? What do you think? Think about it. Medical Matters, see you again soon. It's been a great show. Phil, thanks so much, and best of luck to you and the Wellness Institute of Greater Buffalo.
David, thank you.
For more Medical Matters television shows, go online to medicalmatters.tv.